now we look back at some of this and look back at this journey over these past 10 years, and we see that so many of us suffer from intracranial pressure problems, mast cell activation, or the activation of other histamine-producing cells, which we need to focus on. And then this abnormality with vagus nerve function, perhaps acetylcholine. Some of us have vascular abnormalities. Perhaps POTS and some of these other chronic conditions are not what we thought them to be for so long. And this creates a paradigm shift in treatment. Currently, POTS is being treated mainly symptomatically, trying to increase blood volume. We're not looking at what is the potential cause of all this downturn. We are looking a fair amount at autoimmune conditions, which does not appear to affect the majority of us. We are missing way too much. So when you look at this condition more involving the high intracranial pressure and mast cell activation or histamine-producing cells, vagus nerve problems, and vascular disorders, we can then look at the treatment which are traditional for this condition and how they may be slowing or halting our recovery, and indeed how some of them may be making us worse. For example, Florinef, salt, Gatorade, and even neurosurgeries for the neck and Chiari, etc., may actually be making us worse if indeed we have this idiopathic intracranial hypertension without papilledema. Now, if we're suffering from histamine problems or other cells, inflammation producing histamine, beta blockers, opioids, which so many of us depend on, and even SSRIs can activate those cells and make us somewhat worse in that area. Finally, the vagus nerve and vascular problems that we've been looking at, could it perhaps slow some of our necessary gallbladder surgeries? Heart ablations, most of us kind of understand with POTS. Heart ablation is usually contraindicated. And then IVIG and low-dose naltrexone, which we sometimes will reach for with immune system problems, could correcting the vagus nerve problems actually give us enough of a boost that that'll put us within the norm of fighting infections. I think it's absolutely possible. And it is beyond time to shift treatment for POTS and look instead of treating symptomatically, look instead at looking for the underlying problems causing the change. And only then can we actually recover, as my kids and I have. So the other problem I wanted to point out, because it's so easy for us to get on salt and Gatorade, and they pushed that for me for years, and I was unresponsive. Acutely, that can absolutely help blood volume, but chronically, I don't believe we should be using that because it does damage the inner lining, the endothelium of the blood vessels. And there's a lot of evidence now that it can contribute to autoimmunity. We'd like to avoid that if we can. So where can we go to get treatment and have someone be looking for the underlying problems rather than treat us systemically and by symptoms? Well, I'm so excited now because we can announce that we've opened POTS Care. In 11 years in the making here, looking for these underlying problems. We're a small group of medical professionals that address all symptoms and signs at once. I really think that's the only way to get answers. We try to do things basically non-invasively because a lot of us have problems with inflammation, and some of the testing we can undergo can make us worse. But we also look through all of the medical records and do additional blood work and things like that to locate the underlying problems. We'll take 1 to 2 patients a week, and we try to pre-qualify the patients to make sure it's somebody we feel like we can help. But we're so excited about this because the hardest question I got throughout this journey was, where can we go to get some of these things looked at? And it was such a struggle. So now we have some place we can go. So I am at potscare.com, seeing patients full-time. A lot of this information is also on vagusnervesupport.com. But as always, you can find me at prettyill.com because I still have genetic challenges. I am still somewhat hypermobile and have some fallout from that. I have plenty of medical challenges. But it is so much easier to handle these challenges when you're also not struggling with POTS. You haven't had to recover from what turned out to be unnecessary surgeries, that your GI tract is working well, you're having normal bathroom habits. If you can peel back a lot of those conditions, what's remaining is much more manageable. So what we have to do is look at this condition differently, and it's time. So when you change the way you look at things, the things you look at change. Wayne Dyer, very wise words. So I leave you today with tons of hope. This condition, I believe, for the majority of us, is not what we suspected it to be. We can shift treatment, and we can recover from this condition. So always there is hope. Thank you so much for having me, and thank you so much for your attention today.